Hey, I'm Christy,
I'm Piper.
and we're going to talk to you about your 9 and 12 month follow-ups. So first off, kind of a lot of the same things we've already talked about in the past, but how are you feeling? How's everything going? Any abdominal pain, difficulty swallowing, food sticking, things like that. If you are, make sure to let us know or talk to your provider about that. Also, have you hit a plateau? Have you hit a stall? Are you frustrated with where you're at? If you are, know that that's normal. Everybody hits one at some point. We just kind of have to reevaluate and look at some things that could be causing that.
How are you doing with your habits? Any old habits sneaking in? Are you eating the right things? Are you drinking your calories, or are you making the right choices with what you're drinking? How are you doing with exercise? Exercise should be a normal routine part of what you're doing. If it's not, consider getting an accountability partner to make that part of your consistent routine. You should be performing HIIT training 3 to 5 days a week, along with some resistance to help build, tone, and firm your muscles. Are you drinking any alcohol? If you are, those are empty calories, and they're counting against you as you progress with your weight loss. If you're happy with where you are weight-wise, then it's okay to have some here and there. But if you want to lose more weight, that's something, and you're drinking alcohol, that's something that you can change to help.
Just remember, if any of those other things like Piper was talking about, if you're struggling to get to where you're wanting to be, just remember, go back to your basics. Start off, 5-10 minutes a day, whatever it takes. Just starting off somewhere is important. Some basic exercises you can do that don't take very long are push-ups, sit-ups, squats, planks. Those are all just some basic exercises that you can always start off with, and then you can always build up from there. If you miss a day because you're sick or don't feel good or whatever it is that life throws at you, it's okay. Don't beat yourself up for that day. Just remember to get back in there the next day and get to doing what you're supposed to be doing.
I like to do wall sits. I do wall sits with my patients in the room, so consider those.
She does.
Consider wall sits. They're easy. They don't take any kind of equipment, just a little bit of empty space on the wall. If you don't have a wall space, get on a door and work your way up. Every little bit that you do counts. Are you practicing mindful eating? You should be stopping a bite before you get too full. Make sure you're not skipping meals as a routine. You should be getting 3 meals a day with snacks in between.
Are you taking your vitamins? Are you taking them daily, or do you just take them every once in a while? Some of the vitamin deficiencies can be very problem-causing, so you want to make sure that you're getting your vitamins daily like you're supposed to and like you've been instructed to do. At your 12-month visit, we're going to make sure to give you a lab order to recheck all of your vitamins, minerals, and other things. So make sure that you're taking those, and then when we give you the lab order, we want you to hold your vitamins for 3 days before you get your lab work drawn. And then you can resume your vitamins like normal, and we'll call you and let you know if anything needs to be changed or adjusted.
Your tool of surgery has become your new normal. So keep that in mind as you go out of town, take trips, fun trips or vacation trips or work trips, prepare ahead. You want to have options, and going out of town means you eat out more frequently, and you don't want to be in a situation where you're not prepared ahead of time.
So like Piper said, just make sure if you go on vacation, you plan ahead. But at the same time, know that if there's a restaurant that makes the most amazing whatever it is and you want some of it, it's okay to have a bite of that. Just order it off the kids' meal, split it with somebody. Don't be afraid to throw the rest of it in the trash. Don't beat yourself up if you have a little bit, but also don't blow the entire vacation eating nothing but junk. 1, you'll be unhappy with your weight loss or weight gain, and 2, you'll probably feel miserable. So, allow yourself a little, don't beat yourself up, and know that it's okay.
And in that, keep in mind that 80% of what we get and the way that our bodies look and the progress that we make is based on what we're eating.